खुद को भी थोड़ा फील हो रहा है कुछ ऐसा तो नहीं कि ये माइक ऑन है या और ये बहुत पास है. Is it okay? Or still, am I audible at the back?
Yes.
Okay, fine. Okay. हाँ ठीक आ रही है बस ठीक है. So how are you feeling? Good. This is the second day.
Yes.
Okay. You like Chandigarh?
Yes.
Coming for the first time?
Yes.
Good. Very nice. So it's a beautiful weather nowadays in Chandigarh. Okay. So I'm going to talk a very, very important topic. You all are nursing administrators, I suppose. You all are working at the high positions in your institutions? Yes. Probably. Yes, majority of you might. Okay. So I'm going to talk about the strategic planning for nursing services and what are the various management tools and techniques. Fine? I hope the topic is clear, understandable.
Yes.
So what we get from here? That whenever we are planning anything, we just cannot plan in isolation. Okay, we need to have certain important parameters which we need to keep in mind, and also certain tools and techniques which we will be using, which will help us in planning anything. So, as you all are nursing administrators, can you tell me whenever you are planning anything in your ward, you all are from hospitals? Working in the hospital? Anyone from teaching side? Working in the hospital. You are from teaching side? Very nice. So let's talk about from the teaching side. Whenever you want to plan anything, suppose there is a shortage of manpower, shortage of teachers in your institution, how do you go? How do you plan? You have adequate number of teachers in your institution? Shortage of teachers. So do you want to, rectify that, or you want to continue with the shortage of teachers? How you should do that? Is it impacting your institution, the shortage of teachers?
Very much.
Very much. So what have you done so far? How have you planned? Did you approach your administration?
Yes.
Okay.
First thing we did a needs assessment.
Need assessment.
Yes, where we looked at the number of students present against the teaching staff. We saw that there was a very huge discrepancy.
Yeah.
And we looked at the consequences that came about because of that. One of them maybe is like low performance, student performance at the end of their competence exams. So we planned to say how many more teachers do we need. Yes, then we presented the plan to
the administration.
But then it was forwarded to the government.
Okay.
Yes.
I think what was the output? Did you get the teachers?
We were given one, unfortunately, but
Okay.
we keep on lobbying
Okay.
because it's still not enough.
Okay, still not enough. So at the time of assessment, probably you might have thought of something that how you should be going about.
Yes.
You must have talked to your teachers, to your like senior person or to your junior persons.
Yes.
Okay, and then you have to match it with certain benchmark. For example, what should be the teacher-student ratio in your institution?
It should be 40, 1 to 40.
1 to 14. Okay, usually in India we take 1:10 ratio. Whenever we want to teach specifically in the hospital, in the clinical setting, we go for 1:10 ratio, and then we calculate.
For
and
theory, no, for practical is 1 to 15.
1 to 15.
Yes, then for theory classwork is
For
1
that
to
classroom.
10.
Okay, okay. Did you use any tool? Are you aware of that this tool you can use and then the things might go better?
Yes, there is an assessment tool which we are given by our regulating nursing council.
Okay.
Yes, which stimulates the ideal situation at a nursing college.
Fine, fine, fine. Anyone from hospital side? Yes, please.
I work in primary health care in Ministry of Health in Egypt. I work in the top of management in Egypt. Annually, we make assessment for the need for nurses in the primary health care as manpower, training, complaint of the nurses, revision of the law and regulations. After assessment, we make priority for the need for nurses and put in the plan as priority.
Okay. So you are not making again you are not using any tool or any techniques that if I use this tool it might help later on.
With the technique of need analysis.
Analysis need.
Need analysis
Okay.
as fish bones.
Fishbone.
Fish bones.
Yeah. So I wanted to listen something about a particular tool. So fishbone you are making use of.
We focus on fish bones because details of causes of the problem.
Yeah. Okay. Thank you so much. So you have, yes please, you want to say anything? SWOT analysis. Fine. Thank you very much. Thank you. I'm so happy that you are aware of. Yes, you want to say anything?
Yes, I would like to share.
Yes.
I'm Selena from Thailand, and I come from academic
Okay.
area. So we also have a nursing teacher shortage in Thailand,
Yeah.
especially in midwifery teacher and pediatric teacher. So from my experience from my university, we had a strategic plan for recruit teacher. We had we get a scholar for our students who want to be a teacher and send them to get master degree and get them back to be a teacher. And we have a nursing council, Thailand Nursing Council. We have criteria for the university who had teach a nursing student. It's my one teacher for 8 or 6 students.
Okay.
So we need to recruit a nurse from hospital, nurse from anywhere who want to be a teacher and correct them to be a teacher.
Fine.
Yes.
Thank you so much. So, you want to say something? Good.
I am working in many directorate hotels, and we prepare new hospitals nurses. We make proper assessment and needs for these hospitals, and we make plan how we planning and where and when and time and budget. And we use SWOT analysis in this plan.
Very nice. Thank you so much. Yes. Okay. Yes, please.
Okay, thank you. For those who have just joined us, you can call me Dr. Dan. I'm a student doctor. According to my experience in our county, it's going to rhyme with what Mom said. In our county, there is a level called intermediate. Whoever that reach intermediate and the institution have made analysis looking for more teachers will request the government. And later on, the junior, the youngest doctors will be sent for tutorship. You'll go and learn to become a tutor, and you'll come and back up the academic side on how to train nurse, midwife, pharmacist, and so forth. This will make the county not to have shortage of the teachers.
Okay.
For me, I think things like if you are there as a teacher, you need not to wait until your time finish. You have to make sure that you build up others. Later on, when your time finish, those one will take up your duties. So I thank you.
Okay. Thank you so much. So let us start with the session. My voice is clear. Am I audible? My words are clear, understandable? Okay, fine. So, the title of my talk will be Strategic Planning for Nursing Services, and we will be primarily talking of various tools and techniques, okay? And I will be giving you certain exercises in between, very simple exercises, how to make use of those tools, okay? So, I wish that at the completion of my session, you should be able to understand the concept of strategic planning, that why do we plan the things, the characteristics of a good planning, the importance of good planning, what are the various tools and techniques, and how we are making use of those tools, whether we are in teaching side or we are working in the hospital as administrators. So we know that everyone is very clear that we all are very well versed with the word planning, okay? And those I think you must have learned from your whenever you are doing your diploma or degree course, where we have been using the word planning in the nursing process. First step is the planning. So whenever we want to do anything, it's very important that we should have the plan available with us. That is the first step. Because if you are not planning properly, the execution, the identification of the problems, later on execution of the solutions to that problems might not be much beneficial. Okay, so it's a very important, and we all are very familiar with the word planning, and it is an important step in the nursing process and is an important part of the ward management. You have heard of the word post-cog? Yes. What is the full form of post-cog and where do we use it? Post-cog. Where do we use it? In your administration subject you have learned, in your management subject you might have learned. Okay. So basically this word, this acronym shows us the management functions, and it is a fundamental element of the administration. So in this also you will see the first word is the planning. So it is followed by organizing, staffing, directing, coordinating, reporting and the budgeting. So planning is a very important part of our day-to-day life. So what is strategic planning? It is a structured process through which the nursing leaders, they first define the goals. Very important. Some of you have already discussed certain examples from your institutions. Okay, so we need to set certain goals. Planning helps us in identifying those goals. We need to set the priorities. As per the priorities, we need to allocate the resources and then align the nursing department with the broader mission and the vision. Okay, wherever you are working, whether you are in the hospital, whether you are in the college, you always have certain vision and certain mission. Okay, and we all need to work towards uplifting the vision and mission of any of the healthcare organization. So what is the importance of strategic planning? What is coming in your mind? If we are planning the things properly, what will happen? How it is important for all of us? Anyone? Why we should be planning? Yes?
We should have a vision and a goal.
Yeah.
That's why we are planning, and the strategic planning prevent us from any crisis. It is actually crisis management also.
Crisis management, deviation from the set goals, proper use of the resources, unnecessary wastage of the resources. Okay, so it's very well said by you. These are the certainly important points. That is why we always plan the things, that it provides a clear vision and direction of the nursing services. Whenever we are planning anything, it is not, again, we are not planning in the vacuum. We are always planning along with our subordinates. We sit together. Okay, so we have very directive goals to achieve once we do the thing, once we plan the things properly. So it always facilitates the collaboration and the team. An individual administrator can never plan for the organization. Okay? Whenever you plan anything, you always take into consideration the input of your subordinates. You sit together, you plan the things. So that will help us, facilitate us in having the teamwork in your organization. your subordinates will be very happy. Okay, that you are taking the input from those keepers for any of the problem. Those subordinates will feel involved that our HOD, our administrator is taking the input from them. Okay, so it always improves the decision making. It is understood. Okay, once an individual mind is planning and once the administrator is taking into consideration the input from each and every person of her organization, definitely the decision will be better. It promotes adaptability to change. We are very comfortable with our current practices where we are working. Okay, so whenever a new thing is coming up, to implement that particular thing in your organization and then acceptance by the subordinates, it's very, very difficult. It does happen. We are very comfortable with the traditional practices, let it be nursing or wherever we are. So whenever we want to implement any change in our organization, there will be a lot of resistance from your subordinates. So if you are taking into consideration their input, so adaptability later on will be better. Okay, so that is why planning is very, very important. It enhances the patient care quality and safety wherever we are working. Whether we are working in the college, in the educational institutions, or we are working in the hospitals. What is our main goal? It is to promote the quality care to the patients for the patient safety at large. Okay, so it will help us in promoting the patient safety as well as to provide the quality care to the patients, and it drives the innovation and future growth. Okay, in innovations, new and new things are coming up. So if we are very comfortable with the traditional practices, we will not be able to align with the new innovations. So whenever there are new innovations are coming up, we want to implement those innovations, we need to plan the things. Because, for example, you are working in an intensive care unit. So what is happening? New things are coming up. Probably when you started as student and now you are working as an administrator, new ventilators have come up, new devices have come up to take care for the patients. Initially there was no infusion pumps are there. Number of new things have come up. New kind of beds are there. Initially the beds were very simple. Nowadays with the buttons you can switch on the button and can provide any of the position to the patient. So whenever new things are coming up, we need to be abreast with the technology. And making use of the technology, implementation of the new techniques in any of the units, planning is again very, very important. Okay, and to ensure the compliance with regulations and accreditation standards. Every organization's NABH accreditations, many of the hospitals are there. So if we are not complying to the accreditations or the requirement of that particular organization, we will be left behind. So it's very